Hi, this is Angela Hammett, the Pregnancy Nurse Navigator here at Women's Hospital, and I had the opportunity to sit down with Dr. Elizabeth Sutton, the Director of Scientific Research here at Women's Hospital, for her to explain one of the newest research studies that's going on here at Women's. Oh, thank you, Dr. Sutton, for being with us today to explain some of the new research that's happening here at Women's Hospital. But first off, can you tell me a little bit about what you do here at Women's Hospital?
Yes, so I am the Director of Scientific Research at Women's Hospital. I am a developmental and molecular biologist, which is a big mouthful for saying I'm very interested in pregnancy. And we study how pregnancy exposures can change women's short-term health and long-term health in mom and baby. We have clinical studies where we enroll patients in trials to test medications, to test a lifestyle intervention. We have population studies where we look at tens of thousands of patients' birth outcomes and correlate that with environmental exposures or diet lifestyle habits. And then we have molecular studies where we're pipetting at a bench looking at the placenta or mom's blood or baby's blood too. So we have a really broad research program at Women's Hospital, all focused on pregnancy and maternal and infant health.
Great. So can you tell me about the latest study that you are working on right now? I know it's something you're really excited
Very
and passionate
excited
about
it.
So tell me all about it.
So we have actually launched this week a research program for COVID-19 and pregnancy research. It's interesting, most of the research, if not almost all the research in COVID-19 right now is focused on the COVID-19 positive patient. And that's very important, right? We're testing new medications, we're testing off-label medications, people are looking at treatment courses and how to improve outcomes in those patients. But what this survey study is doing is looking at everybody else. So we are interested in the pregnant mother living through the COVID-19 pandemic. So if you've had COVID-19, absolutely you can be in the study and you can enroll in the survey series. But it is called Pregnant During COVID-19 Survey Series. And so we are asking pregnant women to enroll in this survey series and tell us about how living during this pandemic is affecting them, how it's affecting their mental health, how it's affecting their lifestyle changes, have they been furloughed from work, have they lost a job, how is their food security, are their kids at home, are their kids supposed to be being homeschooled at home? And the idea is to capture snapshots of that experience of being pregnant during the pandemic in real time. And so what we call it is a longitudinal study. So we will, if you choose to enroll, you fill out an initial survey, but you will fill out a survey every week until you deliver your baby. So as our cases go down, as the stay-at-home order is lifted, as you go back to work, we will be able to capture your mental well-being, how you're feeling, those lifestyle changes in real time during your pregnancy as the pandemic progresses and hopefully resolves.
Okay, so can you tell me a little bit more about the survey itself? Like how much time would it be expected that if someone decides to participate, just what are they agreeing to, so to speak?
Exactly, we call it consenting, right? So what are you consenting to in research? And the first survey, we just call it the initial survey, is about 20 minutes. So that sounds short, but can feel long when you're actually clicking through it. It's mobile optimized, so you can do it on your phone. You could do it while you're waiting at your doctor's appointment. You could do it while you're waiting in the lab for your OGTT. God bless you. It takes about 20 minutes, and it collects data on your information, your personal information to contact you. It collects data on your lifestyle choices, like your physical activity, your eating. It collects your perceived stress, which is incredibly important, your mental well-being, your anxiety. And so that's about 20 minutes. And then you will get an email to your inbox every week after, and we'll collect your COVID exposure and social distancing symptoms and practices. So have you been tested for COVID this week? And have you had a fever? Have you had any chills? Have you been practicing social distancing to what degree? That takes about 1 minute. That sounds long, but it only takes about 1 minute. And then there's like a 10-minute extra survey at the end every week. So 20 minutes probably for your first week, and then every week after about a 10-week survey to ask you about your COVID symptoms, and then a specific weekly theme. So how has your prenatal care changed? How has your lifestyle changed? How has your mental well-being changed? And so every week you get a different survey so we can check in on you and you can let us know how you're doing.
And then what do we expect to learn from this study?
Yes, I love that question. So we have designed the study to collect a wide array of data. So again, mental health, physical health, right? We'll be asking about your pregnancy complications, your outcomes, your lifestyle changes, your food security. So we'll have a lot of data to be able to analyze. Probably the most unique and exciting thing about this survey is that, and I'm sure people have heard this 1,000 times like today, but this is an incredibly unique time in our history. And so no one's ever lived through this, and a pregnant woman certainly hasn't lived through this. And so when we have done studies like this in the past, we meaning the scientific community, it's always after the fact. So there's data on if there's been a natural disaster. There's a beautiful amount of data on Hurricane Katrina victims and survivors, and how, if they were pregnant, how they felt after the hurricane. But it's always after. This is an incredibly unique time to be able to tell the story of how you are doing and how it feels to be pregnant during the pandemic in the moment and as it changes. And that's a study we've never really been done before, because we're living in such a unique, what we call exposure, which is the pandemic. The data in Hurricane Katrina survivors is really interesting because it shows, we know in epidemiological studies, which is a fancy word for population studies with tens of thousands of women, that being exposed to a natural disaster or a stress or having anxiety, how a mother feels and what she experiences affects her pregnancy outcomes. There's higher risk for preterm birth after a natural disaster. There's higher risk for low birth weight babies. That does not mean everyone that lives through a hurricane has a low birth weight baby, or everyone who has a natural disaster will have a preterm birth. But on a population level, you can see those trends. And so what this study lets us do is look at that population data and see those trends, while also giving a voice to every pregnant mother that is living through the pandemic and letting her be heard and tell her story.
Wow, that's so interesting. Can you enroll at any point in your pregnancy?
Yes, this is a come one, come all. If you are pregnant, if you are 1 week pregnant or 41 weeks pregnant, we're here for you if you're 41 weeks pregnant, you can always enroll. And the surveys will stop once you tell us that you've delivered your baby.
Okay.
And you will get weekly surveys. And at every survey, there's an opportunity to withdraw. So if you are feeling great and excited about participating and you can do 4 weeks of surveys and then it gets too much, that's fine. You just let us know. Any data is amazing and will help with us to answer our questions.
Okay. So like, would it be, like life happens and you miss 1 week, but you're able to do it the next week?
Yes,
is that okay?
Absolutely.
Okay.
Yeah, any and all help is welcome. I think in this moment, we're really looking for opportunities to do something.
Right.
I think a lot of us personally feeling a little out of control, wanting to be proactive and kind of not able to control the circumstances around us. And I was thinking about how I would feel if I was pregnant and heard about this study. And I do think it would make you feel like you get to do something.
Right.
But it's also, you actually get to do something. So I think you get to feel that way, but you also are contributing to this body of literature. And so you can absolutely enroll whenever you can and just answer as many surveys as you're able to, for sure.
Great, that's so interesting. So Dr. Sutton, how can a patient actually enroll in the study?
Right, so this is an online survey. Again, it's mobile optimized, so you could do it on your computer or you could do it on your phone or a tablet. So all you have to do is visit www.womans.org/COVID research. And you will see the survey described and you can click the link and it'll take you straight to the survey and you can start filling out your information.
Great, thank you so much. We're so excited to hear what you learned from this particular study.
And we will share all of our data. We will give community talks about it, and it's such a unique and exciting opportunity to really reach out and help improve the health of women and infants in our community. And that's the Women's Mission, and that's what our research department always strives to do.
That's great. So it's just a really unique opportunity in a really unique time for pregnant women to really get involved.
Yeah.
That's great. Thank you so much.
Thanks.
We so appreciate Dr. Sutton spending some time with us today, telling us about all of the latest research here at Women's Hospital and how important it is to participate. For any further information, please see our website at womans.org.